You're over 60, and somewhere on your last lab report, one number is circled in red: creatinine. It's the last warning sign your kidneys give, not the first. By the time that number moves, the real damage already happened months ago. This isn't rare. It happens to people who feel healthy, people who never missed a walk or a doctor's visit. Kidneys fail silently, without pain, without any signal you'd notice on your own. Some people lose over half their kidney function before a single symptom ever shows up. Today, I'm showing you 4 foods backed by actual clinical trials in humans and what the honest evidence for each one really says. My name is Dr. Emma Johnson, and this channel exists for one reason: to walk you through what clinical research actually says about nutrition and kidney health, without empty promises. Everything today comes from controlled trials, not folk remedies dressed up as science. Stay with me through all 4. Number 3 has the most fragile evidence of the bunch, but I'll show you exactly why it might still be worth doing. Number 4 does something none of the others do. It may stop your kidneys from getting worse in the first place. Before we get into the foods, one concept, because without it, the rest won't fully click. I call it the hidden workload. Your kidneys aren't running one job. They're juggling several at once: filtering waste, calming inflammation, keeping minerals from crystallizing into stones, managing blood pressure. When one of those jobs gets overloaded, it doesn't always show up on the one number your doctor checks first. Creatinine, the marker most labs lead with, is often the last thing to shift, even while other jobs are already struggling underneath it. That's the hidden workload. Each food today eases a different piece of it. Keep that in mind as we go. Food number 1, ginger. Let me introduce you to Martin, 66, a retired postal worker outside Denver on dialysis for kidney failure caused by diabetes. He'd heard ginger was good for digestion and never thought about it beyond that. Here's the problem. In dialysis patients, urea, a waste product your kidneys are supposed to clear, tends to build up between sessions, leaving people foggy and exhausted. A carefully controlled trial gave diabetic hemodialysis patients 2,000 milligrams of ginger daily for 8 weeks. Urea levels dropped significantly compared to placebo. Creatinine also improved within the ginger group. But here's the catch. That change wasn't significantly different from placebo, head-to-head. So the clearest win was urea, not creatinine. I'd rather tell you that plainly than round it up into something bigger than it is. What to do instead? A teaspoon of fresh or ground ginger in tea, soup, or stir-fry most days is a reasonable starting point. The clinical dose used in the trial was higher, so talk to your doctor before taking concentrated ginger supplements, especially if you're on blood thinners. Wait for number 3. That's the one I'm most careful about, and most proud of being straight with you on. Food number 2, garlic. Let me introduce you to Denise, 61, still cutting hair part-time 3 days a week, managing chronic kidney disease alongside high cholesterol. Her doctor mentioned inflammation was part of her picture. She wasn't totally sure what that meant for her food choices. Here's the piece that matters. Inflammation is one of the drivers behind kidney decline that rarely gets its own line on a standard lab report. In a controlled trial, dialysis patients received 400 milligrams of garlic extract twice daily for 8 weeks. Inflammatory markers dropped sharply. One key marker fell by over 70%, compared to just 20% in the placebo group. A separate trial in hemodialysis patients found garlic lowered triglycerides and oxidized LDL, a marker linked to blood vessel damage, though it didn't move overall cholesterol. So garlic's clearest benefit isn't a number on your kidney panel. It's calming the inflammation that quietly drives kidney decline over years. What to do instead? 1 to 2 cloves of fresh garlic daily, crushed and left to sit for 10 minutes before cooking to help preserve its active compound. If you're on blood thinners, mention it to your doctor first. Quick pause. If any of these 4 have surprised you so far, drop a comment with which one. I read every single one. Food number 3, lemon. The one I want to walk through carefully because the story here is more nuanced. Lemon. Let me introduce you to Alan, 74, a retired engineer with a history of recurrent calcium kidney stones. He'd started drinking lemon water daily, convinced it was quietly fixing the problem for good. Here's the problem. A well-designed trial gave 203 patients with recurrent kidney stones either fresh lemon juice twice daily or no supplementation on top of a standard diet. At 1 year, the lemon group had far fewer stone recurrences, a real result, not just chance. But by 2 years, that gap had mostly closed. Not because lemon stopped working, but because fewer people were still drinking it consistently by then. That's the honest picture. Lemon juice looks genuinely protective against kidney stones. But the benefit fades along with how consistently people actually take it, which says as much about human habits as it does about lemons. What to do instead? If you have a history of kidney stones, 2 to 4 ounces of fresh lemon juice in water daily is what was actually tested. The real challenge isn't whether it works, it's sticking with it past year 1. Food number 4, fenugreek. And this is the one that works differently from the other 3. Fenugreek. Let me introduce you to Cynthia, 68, a retired school administrator managing type 2 diabetes, whose kidney numbers had been borderline stable for 2 years, according to her chart. Here's the part that matters most. In early kidney stress, especially with diabetes, the goal often isn't dramatic improvement. It's stopping a slow decline before it becomes a pattern. In an 8-week trial, diabetes patients were randomly assigned to take 15 grams of fenugreek seed daily or not. The fenugreek group's kidney markers stayed essentially stable. The group that didn't take it saw a significant rise in creatinine and a real drop in how well their kidneys filtered waste over that same 8 weeks. Fenugreek didn't reverse anything. It appears to have prevented things from getting worse during a window where, for the other group, they quietly did. What to do instead? Fenugreek seeds can be soaked overnight and added to oatmeal, or ground into a spice blend. The clinical dose was substantial, so ask your doctor before using concentrated fenugreek supplements, particularly if you take medication for blood sugar. I promised you something useful. 4 questions for your next appointment. 1. Could ginger or garlic interact with any of my current medications, especially blood thinners? 2. Is inflammation actually part of my kidney picture or just my cholesterol picture? 3. Given my history, would something like lemon juice make sense for me specifically? 4. Are my kidney numbers truly stable or just stable so far? That question alone can change how closely your doctor watches it. Any provider worth seeing will take these seriously. If they brushed past all 4, that's worth noticing too. Alan wrote to me a year after starting the lemon juice habit. I finally stopped waiting for the next stone. I just do the thing every morning instead. That's really what this comes down to. Not a miracle in any one food, but a handful of small, honest habits, backed by real evidence that quietly ease the load your kidneys have been carrying alone.